How do doctors diagnose complex neurological issues? Imagine trying to solve a puzzle where each piece might look similar but fits differently depending on the picture. That's what diagnosing complex neurological issues is like. It starts with a detailed medical history and a neurological exam. The doctor asks about your symptoms, when they started, how they've changed, and how they affect your daily life. They check your reflexes, muscle strength, coordination, sensation, and even how your autonomic nervous system is functioning, like blood pressure regulation. This helps them figure out which part of your nervous system might be affected. Next, imaging studies come into play. Magnetic resonance imaging scans use magnets and radio waves to produce detailed pictures of your brain and spinal cord without any radiation. They are very good at spotting tumors, inflammation, or structural abnormalities. Computed tomography scans use X-rays and computer processing to create cross-sectional images, which are especially helpful if there's bleeding, fractures, or large masses. Sometimes, doctors also use positron emission tomography or single-photon emission computed tomography scans. These nuclear imaging tests look at how your brain is functioning and metabolizing, giving clues about tumor activity or other brain disorders. Electrodiagnostic tests are another important step. An electroencephalogram records the electrical activity in your brain, which is useful if seizures or abnormal brain waves are suspected. Electromyography and nerve conduction velocity tests measure how well your nerves and muscles are working, helping diagnose nerve damage or neuromuscular conditions. Evoked potentials measure electrical responses to sensory stimuli, providing insight into how signals travel through your brain and spinal cord. Laboratory tests also play a role. Blood tests and cerebrospinal fluid analysis can reveal infections, inflammation, or specific markers of neurological diseases. Genetic testing, including whole exome sequencing, is increasingly used to identify inherited or complex neurological conditions, which can influence treatment options. For especially complicated cases, specialized clinics bring together a team of experts like neurologists, neurosurgeons, radiologists, and neuropsychologists. They review all your medical records, perform coordinated testing, and consider rare or unusual conditions to reach an accurate diagnosis. Additional tools such as ultrasound of brain blood vessels, contrast dye X-rays of the spinal canal, or molecular diagnostics that analyze tumor biology may be used to gather more detailed information. When it comes to brain tumors, recognizing symptoms early is crucial. Persistent headaches, neurological deficits like weakness or numbness, seizures, or changes in thinking or behavior should prompt a timely medical evaluation. Using these diagnostic tools, doctors can determine the type, location, and size of a tumor, which is essential for planning treatment and estimating prognosis. Remember, diagnosing neurological issues is a careful, step-by-step process that combines clinical expertise with advanced technology. Every patient is unique, and doctors tailor their approach based on your specific symptoms and medical history. If you experience unexplained neurological symptoms, seeking prompt medical attention ensures you get the right tests and care. Always consult healthcare professionals for personalized advice and diagnosis, as early detection can make a significant difference in managing complex neurological conditions.